On this Monday, another 266 people have died of coronavirus in New York City. Today, that total now topping 2,700 as the number of confirmed cases grew to nearly 69,000. There's no doubt that these numbers are staggering, but the governor signaling today that the death and the hospitalization rates have actually started to stabilize. Progress that he says can only continue if New Yorkers maintain their distance. That is why he's ordered the state to remain on pause until April 29th, meaning for at least the next 3 weeks, schools and non-essential businesses will remain closed.
News 4's Ray Villeda is covering New York's push to end this pandemic. He's kicking off our team coverage live from the west side. That is near the USNS Comfort. Ray.
Natalie and Stefan, tonight USNS Comfort is approved by the federal government, by the president, to start taking in COVID-19 patients. That's 1,000 beds on top of the Javits Center and other field hospitals. Relief needed, especially now, because the governor believes we may be approaching the peak in cases here in the city.
I'm pretty sure that's not social distancing.
The view from Chopper 4 troubling. Groups of people together in parks across the city, playing organized games in Forest Park, working out together in Astoria, and even an outdoor gym in Pelham Bay.
Now is not the time to be playing Frisbee with your friends in the park. It's just not.
Governor Cuomo now stepping up enforcement, stepping up fines from $500 to $1,000. He's also extending the statewide pause order, which includes schools and non-essential businesses, until April 29th.
It's not about your life. You don't have the right to risk someone else's life.
It comes as New York is expected to hit a tough week, possibly the peak of cases in the city. While the number of cases is still rising, the increase has slowed down in the last 2 days. It's evident social distancing may be working.
It's not that we're drowning. It's that we're just constantly treading water.
Dr. Derek has survived COVID-19 and is back to work at Columbia University Medical Center.
I went back into the ER empowered to go hold hands. That was all I wanted to do, because I wanted to hold hands with patients.
Her help is needed. So far, more than 3,500 people have been killed by the virus. Council Health Committee Chair Mark Levine tweeted out parks may be soon used for burials. The medical examiner's office said that is not being considered right now. The council member walking it back.
I do think it's important people understand how the city will deal with a shortage of freezer space.
Right now, Mayor Bill de Blasio focused on equipment and personnel shortage. Today in Brooklyn, he thanked workers for helping make protective gear. So far, there's enough for this week. But the mayor says thousands of healthcare heroes are needed for the added hospital beds and field hospitals.
The additional need is 45,000 clinical personnel over this month.
All hands on deck needed on board the Comfort, the Javits, and New York City, the epicenter of the virus outbreak.
We're going to have some victories and we're going to have some losses. This is a long haul. It's a marathon, not a sprint. And we're just, not at halftime yet.
A marathon that still continues. Remember that City Streets program, that pilot plan to close down some streets across the 5 boroughs so that folks could go out and enjoy some fresh air? Well, that's ending. 2 reasons for that. Not a lot of people were using it, and because a lot of officers are out sick, and the officers that are working are needed to enforce other things. We're live on the west side tonight. I'm Ray Villeda, News 4 New York.
All right, Ray, thank you. And you mentioned those officers. This pandemic continues to push the limits of the NYPD. Nearly 7,000 officers called out sick today, and more than 2,000 have tested positive for COVID-19 since this began, including civilian employees. The FDNY also facing challenges tonight. Almost 3,000 members were out sick today. Nearly 500 have tested positive for coronavirus. Nurses in Brooklyn say they're overworked, understaffed, and outnumbered.
And now they're calling for backup from the federal government. These are nurses at the Brooklyn VA Medical Center in Bay Ridge protesting tonight during their evening shift change. Normally, the hospital only takes care of veterans, but they started accepting coronavirus patients to try to help those overloaded hospitals. But now they're overloaded. Nurses at the VA say they are caring for as many as 5 ICU patients at a time, all while dealing with a lack of masks, gloves, and gowns.
Nurses are being sent to the front lines, not only without the proper gear, but without enough nurses to fight this war the way we need to.
Staff members are calling on President Trump to use his executive powers to ramp up production of N95 masks and to send additional staff to help them.